Hello and welcome to part 3 of our mini-series of how to undertake an independent investigation. I will leave an iCard up here if you haven't watched part 1 and part 2, so you can go and watch part 1 because I would highly recommend watching them in order. I hope you enjoy today's discussion with Darren Thorne about his complex independent investigation that they recently undertook and the things that you could learn from that. It's a really interesting discussion and I hope that you learn a lot from it. So during the independent investigation, you mentioned that you speak with staff who've been involved. I can imagine that that is a fairly stressful time for them. How do you manage that?
Yes, it can be. I mean, it depends on who we're talking to and what we're asking them about. But quite often in those discussions, there will be things that the clinicians realise that possibly haven't happened as well as they possibly could do. So I guess we try and provide some sort of top tips and some support and guidance for professionals when they come into those meetings. The first one I would say is if you're going to be interviewed or you're going into a meeting to discuss the care of somebody, make sure that you've got the medical records with you. Make sure that you've had an opportunity to kind of refresh yourself of what happened, and because people see many patients every week, month, year. So trying to recall what happened to an individual, unless it was a particularly tragic event, can be really difficult. So use all the sort of prompts and the notes that you would have. Sometimes that's handover notes, sometimes that's diagnostic tests. Familiarise yourself with the case as much as possible. And we absolutely understand that some of these conversations might be distressing for the staff. So prepare yourself. Maybe talk through with a colleague what the key points of learning are, what your reflections are, so that you've got them fresh in your mind, and you can articulate them in the best possible way. And in most instances, when we're doing an independent investigation, staff will always be given the option to bring a colleague with them to sit in the room. And when we're talking to people, we're not trying to trick them or trip them up. We just want them to give an honest and true account of what happened based upon the records and their recollection.
And it's also not there, as I understand it, to challenge their practice, is it? It's to establish the facts of what happened. Is that right?
Absolutely. You mentioned previously that this is all about learning. So this is about reflection, looking at what could have happened differently and where there are opportunities to do things differently in the future if the same set of circumstances arise. And that's really important. But what we will do is we'll still look at, well, what does national policy dictate? So, if there was nice guidance in a particular sort of clinical area, has that been followed? Has that been translated into local guidance? What's the governance arrangements of the organisation to ensure that policies and clinical practice is kept up to date? Are staff encouraged, enabled, facilitated to go on training to make sure that they're as up to date as possible? We'll consider all of these factors, and of course there are human factors as well. So does the system enable you to do something, or possibly encourage you to do the wrong thing? So we'll look at human factors and other contributing factors as well.
Yeah, and having read the report, I think one of the key things is good record keeping. I know that's really basic, and I've seen it in other areas. Good record keeping and accurate record keeping is it's a fundamental, because then if you do have to go back and return to those notes, you have got good evidence, you've got good, clear information in front of you that you can bring forward. And I think, that's a takeaway I think I took from reading the report, was really good record keeping.
Yes, and there are a number of other recommendations that if you picked up any other independent investigation, whether it's in that treatment specialty or not, you probably see a lot of commonality. Record keeping, as you've pointed out, is absolutely key, but training of staff, dealing with staff shortages is a challenge. Regular audit, really important, and making sure that you're implementing the best evidence practice there is, that you can be delivering.
Yeah, and that supervision and support for staff as well, particularly if it's a difficult, challenging time with maybe staffing issues or whatever. I think that can sometimes slip. People are always so busy, but actually that giving staff that support and that environment to discuss things, because you can learn from things within that environment, can't you?
Absolutely. And I think the other thing I would add to that list is communication. Communication is always an issue, and you can never communicate enough.
Thanks for sharing that overview, Darren, of undertaking a really complex independent investigation, and I think it's a really valuable insight into that world if you're not involved in it. You mentioned that you've developed a board assurance tool, so I will leave a link in the description below so that you can go and download that for free, so you can go and use that in your organisation and make sure you're assured against those latest recommendations in the latest independent investigation report. You can follow Facere Melius on LinkedIn and Twitter. I'll leave those links in the description as well. And if you're joining us via YouTube, please like and subscribe, and maybe leave a comment underneath if anything that you've learned from watching this video. Thank you so much for listening to the Healthcare Huddle podcast. Stay safe, and we'll see you next time.